Hello, Bleeding Edge subscribers. Hopefully you guys are having a wonderful day out there. Colin Tedards here. And again, we're going to be diving in to healthcare and AI. A few weeks ago, we looked at a story as it related using AI to detect sepsis in hospital patients. Today, we're exploring another critical health issue, diabetes. One concerning aspect about diabetes is often its silent progression. Here in the United States, out of 37 million adults with type 2 diabetes, only about 28 million of them are diagnosed. And that obviously leaves a lot of people unaware of their condition. Globally, I didn't know this, but the situation is even worse. With approximately 462 million people affected by type 2 diabetes, only about half of them realize it. And now, despite technology advancement in testing and detection, the primary methods for diabetes has required a visit to a doctor. The first method requires fasting. The second method is an A1C test. Now, these tests are very effective, but they can be inaccessible and unaffordable, oftentimes for many people, especially around the globe. Enter a groundbreaking development in healthcare: AI-powered voice-based disease detection. That's right, disease detection just from your voice. This technology offers like a revolutionary approach to diagnosing diseases like diabetes using just a smartphone and a brief voice sample. A company out of Toronto called Click Health is at the forefront of this innovation with its simple voice test for diabetes. Their method involves recording just a short phrase on a smartphone to determine the likelihood of diabetes. Their approach leverages biomarkers where AI analyzes your voice pattern to detect subtle changes associated with the disease. I didn't know this, but turns out patients with type 2 diabetes have recognizable changes in their voice, including tone and pitch. The accuracy of this test was surprising as well. Based on a clinical study published in the Mayo Clinic, the accuracy rate was 86% for men and 89% for women. Now, you might be wondering, how does this compare to the traditional diabetes test? Well, the accuracy is about 92% for the doctor traditional type 2 diabetes testing. So it's very close in terms of its accuracy, but that's not all. And it might not even be the exciting part. From a technology perspective, the app was actually remarkably simple to build. The team used voice samples from just 267 people who recorded short clips of their voice about 6 times per day. After compiling about 18,000 voice samples, the company was able to leverage AI to do the rest of the work. Now, it's still the very early days for these types of advancements, but imagine when larger data sets and more patient data is used. The potential of this technology extends beyond diabetes as well to other conditions like Alzheimer's, autism, and maybe Parkinson's. This is another great example of what we've believed about AI from the beginning when it started to take off in notoriety last year. That AI is going to accelerate bringing a new technology to the forefront, but it's not going to replace traditional doctors or testing. And diabetes is a great example of it. With so many people living undiagnosed, a simple app-based test might get more patients the help that they need. Now, I know what some of you guys are going to say. Well, there's got to be some great investment opportunities in healthcare and AI. And in some cases, I certainly believe that, but this study is an example of the disruption that is coming in the healthcare space. If all you need is a few hundred patients and an AI application and a cell phone to create a test that's almost as accurate as one that has been used for decades, well, I tell you what, there's going to be a lot of disruption to come for healthcare in the coming years and decades ahead. What is absolutely going to be a guaranteed investment going forward is all the silicon, all the custom computer chips, the networking equipment, the data centers, and the backbone of AI, which we've had our subscribers invested in since I took over here at Brownstone Research. Today's session sheds light on how AI is transforming healthcare, offering hope for early detection and treatment for diabetes. Stay tuned for more insights, and we'll see you again soon.